My name is Avalie Braun, and I am currently enrolled and have almost completed a course in microbiology. I graduated high school with an academic honors diploma and have completed several college courses in science since. Today I'm going to be discussing tetanus. Here is a list of subjects I'm going to be discussing when discussing tetanus. They include the forms of tetanus, the characteristics of tetanus, the causative agent, the type of agent, and the most common treatment methods. There are 3 different forms of tetanus according to the CDC. These forms include generalized, localized, and cephalic. The first type of tetanus we're going to discuss is generalized tetanus. Generalized tetanus is characterized by painful muscular contractions, difficulty swallowing or breathing, rigidity, seizures, trismus, and more. Trismus is lockjaw, which you can see in this picture. This is a picture of neonatal tetanus, which is a result of the lack of passage from the mother's protection. And here is another picture of muscular contraction in a child who has tetanus. Generalized tetanus is the most common form of tetanus. Next, we're going to discuss localized tetanus. Localized tetanus is accompanied by nearly all of the same characteristics as generalized tetanus. However, the characteristics are confined only to an area near the injury site. Next, we have cephalic tetanus. Unlike the other 2 forms of tetanus, cephalic tetanus results in flaccid cranial nerve palsies rather than spasms. Characteristics include facial muscle spasms, a fixed grin, difficulty swallowing, and even eyelid restriction. Next, I'm going to be discussing the causative agent and type of agent for tetanus. The causative agent of tetanus is Clostridium tetani, a spore-forming anaerobic gram-positive bacteria. Spores of C. tetani germinate into toxin-producing bacteria when they enter the body under specific conditions. As I have already stated, the type of agent is a bacteria, which is directly transmitted through contamination of open wounds and non-intact skin. Non-neonatal tetanus typically is acquired when spores enter wounds, including wounds contaminated with dirt, animal or human saliva, or necrotic tissue. Burns, crush injuries, and deep puncture wounds are also at an increased risk for tetanus infections. Even wounds without visible contamination can become infected with tetanus spores. Tetanus transmission has been associated with dental infections, injection drug use, otitis media, pregnancy, and surgery. Neonatal tetanus is typically acquired when spores contaminate the umbilical cord due to unhygienic delivery practices. Direct person-to-person transmission does not occur. The incubation period for tetanus is typically 10 days, but can range from 3 to 21 days. The duration of the incubation period is inversely related to the severity of the symptoms, and shorter incubation periods are associated with injuries closer to the central nervous system. Next, I'm going to be discussing the different treatment methods for tetanus. The goals of treatment are to inactivate the circulating toxin by immediately administering tetanus immune globulin, or TIG, to eliminate the bacteria. This is done with aggressive wound care and debridement to stop further formation of the toxin. Care should also include supportive care and antibiotic treatment for 7 to 10 days. Metronidazole is the most appropriate antibiotic for tetanus. However, parenteral penicillin G is an alternative treatment if one were allergic to metronidazole or couldn't have it for another reason. Patients with tetanus must be hospitalized in a quiet and dim room to minimize muscle spasms. Additional supportive care measures include agents to control muscle spasms and autonomic dysfunctions, and respiratory support, since some of the characteristics include difficulty breathing. Patients should be vaccinated with the DTaP for younger children than 7, while Tdap vaccines are for children older than 10. Infants and children should receive 5 doses of DTaP at 2 months, 4 months, 6 months, and 15 to 18 months, and at 4 to 6 years of age. Adolescents should receive 1 dose of Tdap at 11 to 12 years of age. Children older than 7 can receive Tdap for a catch-up vaccine. Adults older than 10 and 11 and 12 should receive Tdap or a TTCV booster dose every 10 years. Adults who have never received Tdap should receive the Tdap vaccine to prevent the formation of tetanus. Let's review what we just discussed. So, there are 3 forms of tetanus. They include generalized, localized, and cephalic. The characteristics of tetanus include muscle spasms, difficulty swallowing and breathing, and trismus, which is lockjaw, seizures, rigidity, and more. Localized tetanus only affects an area that is confined to the injury site, and cephalic tetanus is rather not muscle spasms but palsies. Tetanus is caused by a bacteria called Clostridium tetani, and treatment for tetanus is immediate administration of tetanus immune globulin, followed up with metronidazole or parenteral penicillin G for an alternative treatment if one were not able to receive metronidazole, and minimizing symptoms for comfort. To prevent tetanus, one should receive a Tdap and DTaP vaccine. Children younger than 7 will receive the DTaP vaccine, and children 10 years of age or older should receive the Tdap vaccines, and we talked about the ages earlier in the video that one should receive these. Adults should receive a booster every 10 years according to the CDC. And here are all of my references. Thank you so much for watching.